If your blood sugar spiked after breakfast this morning, I want you to know something important right away. You do not have to throw out the toast. You do not have to swear off rice or potatoes or pasta for the rest of your life. In my practice, the patients who bring their numbers down the fastest and keep them down are almost never the ones who cut the most out of their diet. They're the ones who add the right things in. And some of what I'm about to show you starts working on your blood sugar within hours, not months. I'm Dr. William Mercer. For years now, a significant part of my practice has been working with patients managing insulin resistance and type 2 diabetes, sitting across the table from people who've been handed the same tired advice for a decade: eat less, move more. And when that doesn't work, here's another prescription to add to the pile. What I've found, appointment after appointment, is that the fastest and most sustainable improvements almost always come from a specific handful of foods that work with your body's chemistry instead of simply restricting it. That is exactly what we are covering today. I'm going to walk you through 9 foods that go after high blood sugar from 3 different directions. Some slow down how fast sugar reaches your bloodstream in the first place, some cool the inflammation that quietly makes your cells stop listening to insulin, and some wake that insulin response back up after years of strain. You do not need to start all 9 tomorrow morning. Add them in one at a time, let them stack on top of each other. And by the end of this video, you will have a simple, specific plan you can begin tonight. Before we get into the list, do me a favor. Down in the comments, tell me 2 things: your most recent fasting blood sugar number, and roughly how long you've been dealing with elevated numbers. I read every single comment, and honestly, it shapes what I choose to cover in future videos for this audience. Here is the piece almost nobody explains clearly in a rushed 12-minute appointment. Blood sugar problems rarely start with sugar. They start with a hormone called insulin. Think of insulin as a key. Its job is to unlock the door on the outside of your cells so that glucose, the sugar circulating in your blood, can leave the bloodstream and get into the cell, where it's actually used for energy. That is where sugar belongs, not floating around in your blood, doing damage to your blood vessels, your kidneys, your eyes, your nerves. Inside the cell, being burned for fuel. Now here's what happens after years of a diet heavy in refined carbohydrates or years of carrying chronic, low-grade inflammation in the body. The lock on that door gets stiff. Insulin shows up, key in hand, and knocks again. The cell is slow to open or barely opens at all. We call that insulin resistance. Your pancreas, sensing that the door isn't opening, does the only thing it knows how to do. It produces more insulin, trying to force the issue. For a while that works, more or less. Your blood sugar stays roughly normal because your body is compensating with brute force. But over months and years, that compensation starts to fail. Insulin levels stay high, and your blood sugar climbs anyway. That is the real story behind almost every elevated fasting number I see in my office. It is not a willpower problem. It is not a character flaw. It is a mechanical one, a lock that has gotten stiff and needs to be worked loose again. Every food I'm about to walk you through does one of 3 specific jobs. It slows the sugar getting into your blood in the first place, so there's less pressure on the lock to begin with. It cools the inflammation that's been jamming the mechanism. Or it helps the lock turn a little more easily again, the way it used to. Let's start with the one that works the fastest. Number 1 is apple cider vinegar. If you want to see a real effect on a glucose meter tonight, this is the one to start with. The active ingredient is acetic acid, and it does 2 things almost immediately after you take it. First, it slows down how quickly your stomach empties its contents into your small intestine, which means the carbohydrates from your next meal arrive in your bloodstream gradually, instead of all at once in a rush. Second, there is good reason to believe it helps your muscle cells pull glucose out of the blood a bit more efficiently, essentially giving your own insulin some extra help doing its job. Research on people with insulin resistance has repeatedly shown that a small diluted amount of vinegar taken before a carbohydrate-heavy meal can meaningfully blunt the after-meal spike. In some of the people I've worked with, that difference is visible on a home glucose meter within the same evening. That is a real drug-sized effect from something that costs a few dollars a bottle at any grocery store. Here is exactly what to do. Take 1 tablespoon of apple cider vinegar, always diluted in a full glass of water, about 10 to 15 minutes before a meal that contains carbohydrates. Never drink it straight. The acid is genuinely hard on your tooth enamel and the lining of your throat over time, and there's no reason to take that risk when diluting it. Works just as well, And if you're already taking a blood sugar medication, mention this to your doctor before you start, because vinegar layered on top of medication can occasionally push your numbers down faster and further than you expect. Number 2 is cinnamon, and you almost certainly already own a jar of it, but the kind sitting in your cupboard matters more than most people realize. The common grocery store cinnamon is called cassia, and in large daily amounts over long periods, it contains a compound that isn't especially kind to the liver. The better everyday choice is Ceylon cinnamon, sometimes labeled true cinnamon on the jar. It's milder, it's safer for daily long-term use, and it's the one I recommend to my own patients. What actually makes cinnamon useful here is a group of plant compounds called polyphenols. They appear to help your insulin receptors grip glucose more tightly, almost mimicking insulin's own signal at the cellular level, while also gently slowing how fast your stomach empties after a meal. Research looking at small daily amounts of cinnamon in adults with elevated blood sugar has found a real, measurable drop in fasting glucose over time. It's not dramatic on its own, but stacked with everything else on this list, it earns its place. The practical amount is about 1/4 to 1/2 teaspoon of Ceylon cinnamon a day. Stir it into your oatmeal, your coffee, or a smoothie. Try to pair it specifically with the meal that has the most carbohydrates in your day, because that's exactly when you want those receptors gripping the hardest. Number 3 gets overlooked constantly because it sounds unfamiliar and slightly exotic, but it is sitting quietly in the spice aisle of almost any grocery store for a couple of dollars, and in my opinion, it is one of the more underrated tools on this entire list. Fenugreek seeds are small, hard, amber-colored, and packed with a soluble fiber called galactomannan. When that fiber meets the water in your stomach, it swells into a thick gel. That gel physically slows the emptying of carbohydrates into your small intestine, which means a gentler, slower rise in blood sugar instead of a sudden flood. And a flood is precisely what triggers a panic-sized dump of insulin from your pancreas. Fenugreek also contains a specific amino acid that appears to nudge your pancreas toward releasing insulin more efficiently, while helping your muscle tissue take up glucose more readily. In my own practice, I have watched fasting numbers begin to shift within just a week or two of a patient adding this consistently, which is faster than almost anything else short of medication. Here is how to use it. Take 1 teaspoon of whole fenugreek seeds and soak them overnight in a glass of water. In the morning, drink the water and eat the softened seeds before breakfast. If the slightly bitter taste is too much on its own, grind the seeds into a powder and stir 1/2 teaspoon into yogurt or sprinkle it over scrambled eggs. Start with a smaller amount than you think you need. This fiber is strong, and your gut will need a few days to adjust to it comfortably. Number 4 is chia seeds, and if you've ever watched them sit in liquid and slowly turn into a pudding, you have already seen with your own eyes exactly how they behave inside your stomach. Chia is one of the richest sources of soluble fiber you can buy, and it forms that same thick, protective gel we just talked about with fenugreek. That gel wraps around the carbohydrates in a meal and slows their absorption down to a crawl. The sugar releases slowly and steadily over hours, which means you avoid both the spike and the shaky, irritable crash that so often follows it an hour or two later. Chia also carries a plant-based omega-3 fat that helps calm the low-grade inflammation sitting underneath most insulin resistance. Cool that inflammation down even a little, and cells genuinely do start listening to insulin's signal again. 1 to 2 tablespoons a day gets the job done. Stir it into yogurt, drop it into a glass of water with a squeeze of lemon, or blend it into a smoothie. Give it about 10 minutes to fully gel before you drink it, and make sure you're drinking plenty of water throughout the day, because all of that fiber needs liquid to move comfortably through your system. If this is the first time anyone has actually explained why these foods work, instead of just telling you to eat healthier and leaving it at that, take a second right now and hit subscribe. I put out a new video every week that walks through the reasoning behind the recommendation, not just the recommendation itself. And if there is someone in your life quietly fighting their own numbers right now, this is exactly the kind of video worth sending them today. Number 5 is the avocado, and most people think of it as a fat to be cautious with because of the calorie count. That fear is genuinely costing them. The fat in an avocado is monounsaturated fat, the same family as olive oil, and it happens to be one of the more blood sugar-friendly foods you can put on a plate. Here's why. That fat, combined with the fiber already inside an avocado, slows down how quickly an entire meal digests. Add half an avocado to a plate of rice or toast, and you are not removing the carbohydrate. You are putting a brake on how fast it turns into blood sugar, so the rise happens gently, over time, instead of spiking. There is also reasonable evidence that monounsaturated fat improves overall insulin sensitivity, meaning your cells respond to insulin signal just a bit more readily across the board. In my experience, this is one of the easiest habits for people to actually stick with long-term because it makes meals more satisfying and cuts down on the urge to reach for a snack an hour later. Half an avocado a day is a sensible target. Put it on your eggs in the morning, mash it onto whole grain toast, or fold it into a salad that already has a starch in it. Wherever there's a carbohydrate on the plate, avocado softens its impact. Number 6 is the whole egg, yolk included. For years, people were told the yolk was the enemy, and that advice pushed a lot of people toward sugary breakfast cereal instead, which is genuinely far worse for blood sugar than the egg ever was. Let me set the record straight. A whole egg is almost entirely protein and fat, with virtually no carbohydrate in it, which means on its own, it barely moves your blood sugar at all. But the real advantage is something doctors call the second meal effect. When you start your day with eggs instead of toast or cereal, your blood sugar tends to stay steadier not just through breakfast but all the way through to lunch. You walk into your next meal with calmer numbers and a smaller spike than you would have had otherwise. The protein and fat also keep you fuller for longer, so that mid-morning craving that sends so many people toward the cookie jar or the vending machine quietly disappears. In my practice, swapping a cereal breakfast for 2 or 3 eggs is consistently one of the fastest changes I see reflected on a morning glucose reading. 2 to 3 whole eggs is a solid target for most people. Scramble them, boil a batch ahead for the week, or fold in some spinach. Put that avocado from a moment ago right on top, and you've built a genuinely strong blood sugar breakfast. Number 7 is fatty fish, and I mean salmon, mackerel, sardines, and herring, specifically. This one does not work by slowing a meal down. It works on the deeper problem sitting underneath insulin resistance in the first place. Chronic low-grade inflammation physically interferes with the insulin signal right at the surface of your cells. Fatty fish is rich in 2 omega-3 fats, EPA and DHA, which are among the most effective natural anti-inflammatory compounds we know of. Lower that inflammation, and the cell membrane itself becomes healthier, allowing the insulin receptor sitting on it to finally do the job it was designed to do. In my years of practice, the patients who eat fatty fish twice a week consistently show calmer, more stable numbers over time, often alongside better blood pressure readings as a welcome side effect. Aim for 2 servings a week, about the size of your palm each. Wild salmon, mackerel, sardines, and herring are all excellent choices. Bake it, grill it, or buy it canned if that's easier on your schedule or your budget. Canned mackerel and sardines, honestly, are some of the most affordable and most powerful foods on this entire list. Number 8 is turmeric, the bright yellow-orange spice you likely already have sitting in your cupboard for curries, and I want you to start reaching for it far more often than you currently do. The active compound in turmeric is called curcumin, and it is one of the more thoroughly studied natural anti-inflammatory compounds in existence. Remember, inflammation is one of the 3 levers driving insulin resistance in the first place. Curcumin appears to work at the cellular level, calming inflammatory signals and, in doing so, helping insulin receptors respond more normally to insulin signal again. There is one detail that genuinely matters here. Curcumin, on its own, is poorly absorbed by your digestive system. Most of it simply passes through unused. But pair it with a small amount of black pepper, which contains a compound called piperine, and absorption increases dramatically. This is exactly the kind of small detail that makes the difference between a spice that does nothing and one that actually moves the needle. The practical approach is simple. Use about half a teaspoon of turmeric a day, always with a pinch of black pepper, stirred into scrambled eggs, a soup, a stew. Some of my patients keep a small jar pre-mixed with both spices on the counter, so it's simply a matter of a quick shake, not a decision they have to remake every day. And number 9, the food people are most surprised to see on a blood sugar list is berries. Fruit gets treated like the enemy in most diabetes advice, and I understand why, but the distinction here matters enormously. Blueberries, raspberries, blackberries, and strawberries are lower in overall sugar than most fruit and unusually high in fiber, along with a class of antioxidants called anthocyanins, the compounds that give berries their deep color. That fiber slows sugar absorption the same way we discussed with chia and fenugreek, while the anthocyanins appear to improve how efficiently your cells respond to insulin. I put this one last on purpose, because it works best layered on top of everything else you've already added, on top of the yogurt with chia stirred in, alongside the eggs, folded into an afternoon snack instead of something processed. It's the food that turns this entire list from feeling like medicine into feeling like an actual breakfast or even a dessert that you genuinely look forward to. A cup of mixed berries a day is a reasonable target. Fresh or frozen, both work perfectly well. Frozen is often more affordable and just as nutritionally intact, since berries are typically frozen at peak ripeness. Add them to plain yogurt, stir them into oatmeal, or eat a small bowl on their own in the afternoon instead of something out of a wrapper. Let me tell you about a patient I'll call Marjorie. She was 67 years old, recently retired, and her fasting blood sugar had been sitting stubbornly in the 170 tebas for months. Her doctor had just raised the possibility of adding a second medication, and she came into my office frustrated, almost defeated, because she'd already cut her carbohydrates down to nearly nothing on her own, and her numbers still weren't moving the way she needed them to. We didn't cut anything further. Honestly, there wasn't much left to cut. Instead, we added eggs and avocado replaced her cereal in the morning, a tablespoon of diluted vinegar before her largest meal of the day, cinnamon and turmeric, with a pinch of black pepper stirred into her coffee and her evening soup, chia seeds folded into yogurt in the afternoon instead of a granola bar she used to grab out of habit, fatty fish twice a week, and a small handful of berries most days, usually right alongside that same yogurt. Within the first 10 days, her morning numbers had already started to shift downward, which genuinely surprised her. By 3 months, working closely with her own physician the entire way, she had avoided that second medication entirely, and her 3-month average had moved meaningfully out of the diabetic range for the first time in years. She did not starve herself to get there. She did not white-knuckle her way through hunger and cravings. She simply gave her body the right raw materials, consistently, and let her own biology do the rest of the work. Here is why stacking these foods works when cutting carbohydrates alone so often stalls out after a few weeks. The fiber-rich foods, fenugreek, chia, and berries, slow the glucose down so your pancreas never has to panic and overreact. The fatty fish, the turmeric, and the omega-3s in chia cool the inflammation that was jamming the signal in the first place. The cinnamon and the vinegar walk right up to the insulin receptor itself and help it grip a little tighter again. And the eggs and avocado steady the entire foundation underneath every meal that follows. Do that meal after meal, day after day, and a cell that had essentially stopped answering insulin's knock slowly starts opening the door again, sometimes on the very first try. That is what it actually means to reverse insulin resistance at the level of the cell, rather than simply forcing a number down from the outside with medication alone. And once that door starts opening on its own again, your body tends to hold that improvement, which is exactly why Marjorie's numbers didn't just improve for a few weeks and then drift back up. They held. Before you run off and start all of this at once, I want to draw one clear, important line. If you are currently on insulin or on an older class of blood sugar medication called a sulfonylurea, these foods can lower your blood sugar quickly enough that your existing dose may suddenly be too strong for your new numbers, and that can push you into a genuinely dangerous low. Please add these in with your doctor watching your numbers alongside you, and let them adjust your medication downward as your body actually improves. Do not stop or change a prescription entirely on your own. Bring this list to your next appointment instead, and use it as the starting point for that conversation. And I'll say this plainly, because I think it matters. Everything I've shared with you today is meant for general education, not as a personal medical recommendation tailored to you specifically. Your own history, your current medications, and your lab values all matter enormously, and your own physician is the right person to help you apply any of this safely to your particular situation. So here is what I would actually do, starting tonight. 6 simple steps. 1. Tomorrow morning, replace your cereal or toast with 2 to 3 whole eggs and half an avocado. 2. Tonight, soak a teaspoon of fenugreek seeds in a glass of water and drink it first thing when you wake up, free. Pick up Ceylon cinnamon, not cassia, and start with a 1/4 teaspoon a day stirred into your coffee or oatmeal. 4. Before your largest carbohydrate meal tomorrow, take 1 tablespoon of apple cider vinegar, diluted in a full glass of water, about 15 minutes ahead of time. 5. Add half a teaspoon of turmeric with a pinch of black pepper into one meal a day, whether that's eggs, soup, or a warm glass of milk before bed. 6. This week, work fatty fish onto the menu twice and add a cup of mixed berries and a tablespoon or two of chia seeds on the days in between. You are not taking anything away that you actually love. You are adding in the foods that protect you, one at a time, until they simply become how you eat. If this helped connect the dots on your own numbers, take a moment right now and subscribe. I bring you research-informed information like this every single week. The kind that actually explains the why behind the advice, instead of just handing you another prescription and sending you out the door. Tell me in the comments which of these 9 foods you're going to add first, and if there is someone in your life quietly struggling with their own blood sugar, send this to them today. They deserve to know this too. I'm Dr. William Mercer. Take care of yourself. Your body is more capable of healing than you have likely ever been told. I'll see you in the next one.